Welcome, everybody, to another BJ's Connections podcast. I have the wonderful privilege today of talking with David Cook about something that really impacts a lot of us. And I'm excited to have him be able to share this great opportunity with you. So, David, thank you so much for joining me today.
Thank you so much, BJ, for having me. I appreciate it.
Yeah. Well, let me tell you just a little bit about David. David is one of my associates up in Canada. And of course, I met him through networking, like I meet a lot of great people. And David was introduced to an insurance opportunity that really can help those of you who either have trouble getting insurance, you're paying through the nose for insurance, and it's not doing what you want it to do. Because I know that that is an ongoing concern. Insurance changes all the time, the prices go up all the time. So we're talking health insurance, in particular today. So I'm going to ask David just to kind of introduce himself, tell you a little bit about himself and how he came across this plan. And then I'm going to ask him a bunch of questions so that you have a really clear picture and know how to connect with David to get more information. So David, thanks again. And tell us just a little bit about yourself and how you ran into this program.
Well, thank you very much. I really appreciate it. Good day, everyone. It's a pleasure to meet you. Um, I'm so excited because I am a part of a much larger business that offers essential services and impact health during our business 3 years ago. And although we offer several other services, I focus on impact, because this is one of the greatest challenges facing Americans today. So I'm very honored to be able to offer this service to you.
And how did it come across through the company you were with, right? So it was introduced into the company 3 years
That's
ago. Okay, awesome. So tell us a little bit about what Impact Health is and why it's better or why it's an option versus some of our other insurance companies out there.
great question. Impact is an affordable alternative to health insurance. It's first of all, it's a not-for-profit organization. That's a very important distinction. Health insurance, as you know, very much for profit. Um, and we're a health sharing organization. There are many health sharing organizations out there. In fact, health sharing started in the 80s. What makes us different? That many health sharing organizations are Christian-based, which nothing's wrong with that. However, you must be a Christian to be part of it, or a certain denomination. Some of them actually require a letter from your pastor. We believe in love thy neighbor approach. Everyone's your neighbor. So this is available to everyone, regardless of religious affiliation, sexual orientation. Everyone deserves access to quality health care. So that's what we're about.
Very nice. And if I understand correctly, this program also offers a discount program on vision and dental.
You are correct, absolutely. With the dental portion of it, we're linked to the Carrington network, right? So when you become a member, you get a list of all the services that network provides. So even before you go to the dentist, you know what you're paying, and it's a significant discount from the traditional or from what you would regularly pay for dental insurance.
No, that's an important piece of just our financial budget to be able to
Absolutely.
have, some dental help and some vision help. So the other thing that I understand is this program has some real solid, like how much out of what we would normally call out of pocket. So it's not quite so nebulous. It's pretty clear. It's pretty cut and dried as far as you know what your costs are. Can you just touch on that a little bit?
Well, that's what's one of the things that makes this so enticing or different than everyone else. we are very transparent. You can see where the money is going. You can see where the money is coming from. So that's one of the things that I enjoy. Um, there's nothing hidden from the member. So that's another aspect of our company that I love.
Okay. And I remember you telling me just a little bit about an experience that one of your associates or someone you work with had with Impact and how grateful they were. Can you just share that little story so we understand kind of how broad the coverage is?
Certainly. This individual, he lives in Arizona, Scottsdale, Arizona. Him and his wife came to Canada for a ski vacation. Unfortunately, his wife hit a tree. Not recommended. So she blew up her knee. It was very, very serious. Although they were out of the country, Impact took care of everything. There was no issues, no kickback. So that's amazing. And find an insurance company today who would do that? Not very likely. If you do, you'd probably have to pay more for it.
So there's a difference between in-network and out-of-network for most insurance companies. Why don't you touch on that one?
Absolutely. Actually, I'm going to share a little story that I heard a little while ago. This woman had an operation, and the surgery took place in her network, at a hospital inside of her network. However, they had to call a doctor who was outside of her network. So she got $130,000 bill. Yeah, it's kind of cringy. They were able to bring it down a little bit, but still, that was still a big drain on her finances. So with us, there's no network. So you can go to any service provider within the USA. We are currently in 48 states.
So it's not necessarily based on whether the doctor accepts your bill. It's the bill just goes straight to Impact and they deal with that and you pay whatever the difference is like you normally would. Is that correct? Or
That
close?
it's very, very close. Actually, you're right on the one account that it goes direct to Impact. And one of the things, or one of the benefits of dealing with Impact, as you may be aware, the prices that the hospitals and doctors charge, they're inflated. But Impact knows the industry standards. So what they'll do, they'll negotiate the price down on your behalf. So once it's down there, a very simplistic way of how Impact works. You're responsible for 10% of the bill. So say, for example, you receive a $10,000 medical bill, you'll be responsible for $1,000 of that bill. And then 90% or the remaining 9,000 will be shared among its members. But what's interesting as well, you have a $5,000 cap. So you're not allowed to pay any more than $5,000 in a given year in a given year. So say for example you have surgery and it's $100,000 surgery. 10,000 10% of that is $10,000. But since you're not allowed to pay anything more than five, you would pay the $5,000 and the remaining $95,000 will be shared among its members.
Wow. Wow.
Yeah,
Yeah, that's just such a gift. Truly such a gift.
absolutely.
So no network, dental and vision, solid numbers on what you have to pay and what your caps are.
Right.
And is there a drug policy or medicine, a drug discount?
Absolutely there is. I'm glad I'm glad you asked that. With Impact, there's also a wholesale drug plan,
Okay.
right? So when you become a member, there's a member portal. And so you go in and you will be able to see all the pharmacies in your area. And if you're looking for a particular medication, you enter that medication and it shows you the prices of each pharmacy that's there. And what's interesting, if you have a generic prescription, and if that prescription is $10 or less, that's free.
Okay.
So that's pretty cool.
That's pretty cool. I mean, seriously, there's a lot of benefits to this program.
Absolutely.
So how can
Absolutely.
someone reach you, David? In case they're just listening and they don't happen to look in the description or watch the video, go ahead and tell them exactly how can they reach you.
Yeah, you can send me a quick email. Just for it doesn't get lost. Just put impact in the subject line. And my email is D as in David, P as in Peter, Cook, COOKE 27 at gmail.com.
So they can reach you at D as in David, P as in Peter,
Yep.
Cook, COOKE as in egg,
Yep.
27
Yep.
at gmail.com and put impact in the subject line. All right.
Fantastic.
Is there anything else that you would like to share with us today about the benefits of impact or where the coverage is or how difficult is it to be accepted or register for it?
Well, to register for Impact is very, very simple. I can help you with that. You just go to my website and you can send me a quick email. We'll go over it together. I'll even give you a quote.
Okay.
One of the benefits that I really, really love is that because this is not insurance, we have different terminologies. So we have what you would know as a deductible. We call it a primary responsibility amount. Different term, same difference.
Okay.
Now, what I really love is we want you to be healthy and we want to support that. So we would give you up to $150 wellness credit to do that. So if you have a gym membership, take supplements, massage, acupuncture, whatever you have to do to maintain your temple, we will support that. And if you max out the wellness credit for a year, that's $1,800. So if you take our lowest deductible from a responsibility amount, which is $2,500, and you max out the wellness credit, your deductible drops to $700. That's absolutely outstanding. So I love that.
That's beautiful. That's really beautiful. All
Very nice.
right. I can't think of any other questions I want to ask you. I just want this information to get out to people. Oh, the other one I do need to ask you is, where is the coverage available?
The coverage is available in all 48 states, plus Puerto Rico. The only two states that's not yet covered is Washington State and Rhode Island. If I can make one more point, which is kind of unique to us, um, in order um for insurance companies, you require a social security number. But with us, if you're from either Canada, Mexico, or Guatemala, and if you don't have a social, but you do have an ITN number, you can still be accepted.
Okay. Wow. Now,
Yeah.
quick question. So Canada has insurance already for their citizens.
Right.
Would there be a benefit to anyone to use this in addition or re in replacement?
Well, this is actually primarily for U.S. citizens
Right.
and the citizens of Puerto Rico.
Okay.
So Canada really we don't need it because we're covered through I mean universal health care. So
Okay.
so we're good. So the company that I deal with, and I'm sure some of your viewers may question, he's Canada, how's he gonna help us? Right? I work with a company, they're based in Florida, Davies, Florida, right? So that's how I have my
Okay.
in with the US what's going on there.
Okay. Excellent. All right. Well, thank you again. This has been really insightful. I think it brings hope to a lot of people who have trouble with either getting insurance because it's too expensive, and or they're already paying too much and they really need a break so they can put better food on the table or take care of bills, instead of putting it all into health insurance. So thank you so much, David. I really appreciate having you with us. It has been insightful and enjoyable.
Thank you so much, BJ, for having me. I truly appreciate it.
All right. Well, we will sign off for today, and I will see all of you on the next BJ's Connections podcast.